Hello people, welcome to my channel Physio Guide by Divya. So in previous video I have explained you the definition of TENS. Once again have a look at it. So TENS, from the word TENS only we can understand the definition, that is TENS, transcutaneous, means penetration through skin. What penetration? Stimulation, that is penetration through skin by the electrical current. Okay, transcutaneous electrical nerve stimulation, electrical current produced by a device to stimulate the nerve also we can say. So it is the application of low frequency current in the form of this I have explained, pulsed rectangular wave current where surface electrodes on the patient's skin. Okay, next, many different type of TENS apparatus are manufactured and some parameters are given. So pulse shape is usually rectangular only, we have understood from this, and pulse width is 50, 100, 200, 300 microseconds, and frequency can be low frequency, low wave, that is 2 Hz or high as 600. So usually it is used 150 is common. Okay, frequency. Intensity can be varied by us, varied from 0 to 60 milliampere. So therapist, we can control the intensity. Frequency can be fixed and intensity it is controlled by a therapist. Okay, therapist can control the intensity. A tingling sensation can be felt. Tingling sensation means slightly picking, picking like sensation, timmiri laga picking like sensation can be felt when by increasing the intensity. Okay, now application means large main units are available to produce current conductive rubber electrodes covered with the conducting gel is applied over the electrodes and it is placed over the skin of the patient. Okay, conductive rubber electrode covered with a conductive gel in order to gain good skin contact. To attain a good skin contact placed on patient's skin, electrodes can be bandaged onto the patient or fixed with adhesive tape. To fix the electrode, we can tie it with the tape. Okay, to fix it properly. Now, position of an electrode, where electrodes are to be positioned, where electrodes are to be placed. Acupuncture points means the main points, area of the skin related to certain landmarks on body, landmark like points on the body, specific point on the body. Those points are called as acupuncture points. And motor points means points with the higher excitability of muscle. When minimum intensity only, if we give minimum intensity, the excitability will be more, that points are called as a motor points. Those points are the motor points, and the main points those are and trigger points. Okay, in these points the position, the electrodes are to be placed, and the area of greater intensity of the pain, where the patient will feel more pain, at the exact position only we can place it, or the appropriate dermatome or and spinal segment. Spinal segment means spinal nerve segment, spinal foramen like cervical to coccygeal, cervical, thoracic, lumbar. At one segments from cervical to coccygeal, and appropriate peripheral nerve. Okay, once the electrode has been positioned, TENS can be applied at common method, by this common method. Okay, these are HighTENS and LowTENS. HighTENS means frequency between 100 to 150 Hz, and pulse width which is 100 to 500, and intensity 12 increase from 12 to 30. In this high frequency and low intensity electrical stimulation is applied. This stimulation will cause impulse to be carried along with the large diameter afferent fibers and produce presynaptic inhibition of the transmission of nociceptive A delta and C fibers at substantia gelatinosa of the pain gate. Means, see, in HighTENS with large diameter afferent fibers. Large fibers, these are the small fibers, A delta and C fibers. In this A beta fibers, and projection of nerve and inhibition of nerve to brain. Okay, so along with large diameter afferent fibers and produce presynaptic inhibition, means decrease stop of transmission of transmission of A delta and stopping of A delta and C fibers at substantia gelatin of the pain signals. Okay, by these large fibers. Now low-TENS means the frequency is 1 to 5 and pulse width is 100 to 500, intensity of is 30 or more. In this low frequency, this is low, and high intensity is increased electrical pulse. It gives a sharp stimulus, and like a muscle is twisted, and this muscle is twisted at the nociceptive stimulus and carried towards cerebrum. It passes through midbrain, causing preaqueductal area of gray matter and raphe nucleus to release the opiate, means mattu like opiate means related to drug like substance at cord level. Encephalins and endorphins released block transmission of pain circuit. So pain circuit will be blocked and pain will be decreased. Okay, by this stimulation. BurstTENS means high frequency, short pulse, high intensity current is used in pulse related to 1 to 5 times per second and lasts for 70 ms. Means in the benefits of this BurstTENS are that it combines both conventional and acupuncture like TENS, and thus provide pain relief by this both acupuncture and conventional by these both routes. Okay, pain relief is felt. Now treatment. TENS can be used for single daily treatments of 40 minutes duration, or 30 minutes we can use. Portable TENS can be means short pocket, like we can say, can be used continuously for 24 hours. TENS can be day or night. TENS can be used in night in treatment of phantom limb pain. Phantom limb pain means if the person who lacked the original limb and they feel if the leg or arm will get amputated means cut, or they feel pain in limb in that area. If they feel pain at that area where no longer the limb is existed, okay, where no leg is present, they feel like originally have limb and they feel pain. Okay, that is phantom limb pain. Indications for whom this TENS can be used: for chronic pain syndrome, phantom limb pain, and reflex sympathetic like nerve pain, and reflex nerve dysfunction, or arm or leg after injury, surgery, or heart attack, like that. Reflex in sympathetic dystrophy for them also. Post operative pain means after operation this can be used. Obstetric pain means after delivery they feel the pain, for some time the acute pain. So after delivery also we can. Contraindications and dangers for whom this TENS machine is not advised, means continuous of high TENS is not advised. Electrolytic reaction, because there will be any electrolytic reaction below the skin surface. And cardiac pacemakers, because interferes with the frequency of pacemaker. For pacemaker, who have introduced pacemaker patients also, we will not advise. And avoided in first to 3 months of pregnancy. And hemorrhagic condition, who lose their blood, will not apply at that position. But open wounds, where the open wounds also will not advise. And carotid sinus means the carotid artery, dilation of carotid artery, means widening of light. Open mouth and near eyes etc. will not apply this electrodes and will not apply this TENS. So once you take a screenshot if you want to. So I hope you understood this topic clearly. So thank you for watching my video. I'll show you the video also clearly. So thank you for watching my video, and do follow my videos.